It's a great pleasure to be with you today in wonderful Monte Carlo. And to tell you the truth, I'm really honored to cooperate again with two big companies. One is the Fotona laser, the other is Stratpharma. When we perform laser procedures, we need first diagnosis, analysis of the patient. We need proper technology, proper knowledge, and then we perform the procedure. Do we finish when we finish the procedure? No, we finish the procedure when the patient is healed. So the post-op procedure is almost as important as the procedure itself. So this is not the first time that Fotona and Stratpharma cooperate. We had a very, very successful cooperation in Australia where we perform many lectures all over Australia, combining the two knowledge together. So today I'm going to share with you the latest combination treatment proposed by Fotona, which is Fotona 4 Glow. The Fotona 4 Glow brings the patient the advantage of two different worlds. The world of photoacoustic treatment, of photoacoustic laser tissue interaction, and photothermal laser tissue interaction. So you know that today we talk about longevity. We talk about prejuvenation. We talk about rejuvenation. All concepts which are very important. Procedure, we are asked constantly by patients to perform procedures which are not that aggressive, if possible, and they produce some, let's say, efficient kind of results, accompanying the patient along the process of aging, okay? So, everybody knows that we don't need hot temperatures just to stimulate collagen and to renovate the skin. We can also stimulate that with a photoacoustic vibrational effect. So, we have these 4 steps. So, we have one laser, which is a pico laser, 300 picosecond, one of the most powerful 300 picoseconds on the market. The first pass is, we call toning. Toning means you have a larger spot, 8 millimeter, 10 millimeter. In order to have this kind of larger spot and have the proper, let's say, energy, you need a powerful source. What kind of wavelength we use? 1064. 1064 was considered the Cinderella wavelength many years ago because they were not linked to a specific chromophore. Okay, but now we know that this wavelength is fantastic because we can, with the proper knowledge and a proper technology, address melanin, water, and of course hemoglobin. So step 1 is a picosecond laser, full beam. Let's say, priming of the skin, which is addressing the irregular pigmentation. So a toning, a uniformity. So it's addressing not only the melanosomes, which are not performing or not evenly distributed, but also the melanocytes. So they give a little shock. At the same time, the penetration is giving some vibrational effect in the dermis. Then we move to step 2. Step 2 is performed with a micropulse 1064, always 1064. Micropulse 1064, called frac-free, we can use 0.3 millisecond or 0.6 millisecond, very short pulse. And with this short pulse, we address and we redefine vascular imperfection. And we address also the inflammatory, because this Nd:YAG has an anti-inflammatory effect. You know that inflammaging is also one of the causes of aging. Then we go to step 3. Step 3, we use 1064 again with a longer pulse. Longer pulse. Why a longer pulse? Every time we do something to the skin, we modify the target. We modify the equilibrium of the chromophores. We increase more water, we increase a little bit of erythema. So when we use the step 3, which is the piano, according to the Fotona protocol, it is a very, very long pulse warming of the skin, creating a kind of stimulatory effect on the fibroblast. Okay? So this creates a deep tightening and rejuvenation with the Dynamics Max, which is the other platform. So one picosecond platform, and the other is a no picosecond, is a picosecond laser. And step 2 and 3 are with the combination of platform containing erbium YAG and ND YAG. But in this case, we use just the ND YAG. Step 4, we have been working with 1064 deeply. Now, you know that you can transform a cylinder of light into microcones and becoming, a fractional. So 1064 can be, of course, transformed in a kind of microarray of pixel. And the pixel, every cones have a shape which concentrates the energy to the very tip of the cone. If I concentrate the tip of the cone and I focus the tip of the cone on the surface of the skin, the major action, the photoacoustic vibration, happens on the first level. So I can disrupt the epidermis and I can sculpt the epidermis. If I focus the tip of the cone under the surface, if I shorten the spacer, so imagine the cone, this is the surface, the tip of the cone is here, so the largest section of the energy is not creating anything on the surface. Underneath, we have the focusing of the maximum amount of energy there. So we have a vibrational kind of micro disruption of the collagen fibers and the dermis. 1, 2, 3, and 4 are synergistically affecting the skin, and why we call glow, because a healthy skin is glowing. Why? Because the surface of the skin is hydrating, the surface of the skin is even, so the light reflects. Okay? This is why we call it glow. In order to have a glow effect, you need to have a uniform structure in the dermis and a uniform structure on the epidermis. This is why we work at 2 different levels. Okay, it is painful. It is very well tolerated. And we have in the other room, you can see the patient is already on the table. Dr. Susanna Marini and Nuzema is there. And Dr. Susanna, yes, how Susie?
Hello.
So Susanna is going to perform for you the foreglow.
Hello, everyone. Can you hear me?
Yes, Susie.
Excellent. Okay. So thank you very much for the introduction. My name is Dr. Susanna Marini, and I'm here to perform the Fotona 4D. Fotona 4Glow. So we have our lovely patient here, Diana. Diana, do you mind sitting up a little bit so we can have a little bit of a look at your skin at a closer? Yes, exactly. Perfect. So Diana, she's a 30-year-old. Okay. This is her first laser treatment. She's just had a little bit of topical numbing cream on her face just to make her a little bit more comfortable, okay, since it's the first time she's approaching this kind of treatment. And I think it's an excellent time to start this journey as a preventative approach, so as a prejuvenation approach, okay? So just looking at her skin, as you can see, she's got I would say she's a skin phototype 2, and very mild, let's say, erythema, I think mainly given from the topical anesthetic, but there's no particular dyschromias that can be visible. Closely, you can notice just some mild superficial lines that are just starting to show. And I think the Fotona 4Glow is a very good approach because it will uniform the skin and give her the glow that she, maintain the glow that she's currently already having, okay? Excellent. So you can come back down. So very important, obviously, is to protect the eyes when we're doing any kind of laser treatment. Excellent. Okay. Are you comfortable? Okay. So as Dr. Marini, I think, has already described, we're going to be doing the Fotona 4Glow treatment, which combines 2 technologies from Fotona. The Pico Pro, using a large full beam, okay, for a toning effect. And that's the first one that we'll be doing today, right now. Okay, so I'm just going to start. And Dr. Marini, if you like, you can explain whilst I'm also performing the procedure, okay?
Thank you, Susanna. I think that Susanna now, she start the laser, and we usually, when we do a full face, we mentally divide the face in cosmetic units.
Okay.
So you treat one cosmetic unit at a time. So
Just turn your head
right
slightly,
cheek,
just
left
perfect.
cheek,
So I'm gonna
perioral,
start now, just a
forehead,
second.
in order to be systematic, okay? And nasal. And you see the spot is large. Susanna is using 8mm spot. And you see, she's doing a kind of crisscross painting technique, okay? In order to distribute the energy very, very evenly on the skin, on this skin. Nothing but a little bit of pinprick, okay? A minimal, not thermal, but just the pinprick, because we're using 300 picosecond pulses. So we don't create any thermal effect, okay? And you see, she's doing a crisscross, very, very, of course, the hertz, she's using, I think, 10 hertz.
10 hertz, yes.
10 hertz
10 hertz.
allows you to be fast. So
And in
you
a
can
painting
distribute
mode.
very, very evenly due to the fact that this technology allows you to recharge the batteries to fire one spot after the other to get this kind of nice and fast distribution. This strategy can be finished or can be performed in
straight.
less than half an hour. Okay? How many of this procedure you suggest to your patient? As many as needed in order to get the glow. Okay? It depends on when you start. In this case, we started as a prejuvenation. The patient is already young. She wants to be still young and to keep the young aspect. So this is the prejuvenation effect.
Hide your lips,
If the
Nana.
patient is already a little bit older and with some damage, then of course we need also to modify the technique in order to get the patient back to the ideal situation for her or his age and continue the maintenance. So once a month, once every 2 months, until we got the glow. That means that we reach the best level possible of the evenness of the pigmentation, the evenness of the structure, the dermal and epidermis, and then of course we keep the glow for 3, 4 months, 6 months. So we repeat the treatment 1 or twice a year, okay? And really, this is very well accepted by the patients. And the technology today allows, you see, to be very, very smooth and fast. This cylinder of light, which corresponds to the spot that you can see, it's not focused. This is collimated. Collimated means that the beam doesn't need to be perfectly in focus according to the spacer. You can just move 1 centimeter back and forth, and you're still in focus. Another thing happens when we use the fractional, okay, Q switch. The fractional, you need to be in focus because if you're out of focus, you focus the tip of the cone on the surface of the skin and not under the skin, okay? So here, the advantage of the laser and the beauty of the laser, this is not contact surgery. So you don't need to be in contact. And if in a complex anatomy like the facial anatomy, you can really, distribute evenly all the laser energy despite of the complexity of the anatomy. You see, very, very fast distributing. The patient will turn a little bit pinkish, okay? This is the inflammatory reaction that we create using this kind of technology. When you do this on the forehead, always check if the patient has some cosmetic tattoos on the eyebrow. So if the patient has cosmetic tattoo on the eyebrows, always protect with a white tape in order to avoid unnecessary, removal of the tattoo, because 1064 can remove the pigment. In this case, she doesn't have it, and so we don't protect it. Maybe Susanna at that time doesn't have it. We usually protect the eyebrows anyway. And you see, she is moving very, very fast, according to the cosmetic units. Don't go like this. You need to be systematic. You need to distribute the energy very well. Okay? Okay. What are you doing with this pass? You, as I told you before, you are addressing the minimal accumulation, abnormal accumulation of pigment, because this is creating a kind of uniform toning effect. So if you have accumulation of pigments on the surface, in the epidermis, and in the dermal layer, you can really eliminate. Okay? Very, very gentle. You finished, Susanna?
Yeah, so we just finished the first pass. In order to cover the whole face, we normally use around 2,000 pulses, roughly. At the moment, I'm at 2,300, okay? For the whole face, and the patient was very comfortable throughout the whole procedure, okay?
Why we use the frac-free after the toning with the Q switch? Because you see the color? The face is a little bit erythematous. So we modify the absorption. Now we use the short pulse Nd:YAG, which is not photoacoustic. We create this this kind of effect on the microvessels that we're able to dilate with the first pass. So we modify the absorption with the first pass. She's using now a 4 millimeter spot.
Yeah, 4 millimeter spot. And the other thing that I always try to, obviously I asked her to remove all her earrings and her jewelry, okay? That's very important as well. Also because we like to fade the treatment also on the earlobes, which is an area that is often forgotten, but it's definitely part of the anatomical, let's say, sections of the face, okay? So I always pull the skin as well, especially if someone is very lax next to the ear. If you're pulling the skin, you're able to relax this area. Just turn your head slightly like that, yeah. I'm pulling this area. If she had a lot of, let's say, laxity, I'm able to really extend it and make sure that I'm treating the whole surface of the face, not all the wrinkled skin structures, okay? So I'm gonna start now. Just a little, 1 second. I'm just gonna add in the air. There is no
Fotona SP Max is a very unique way of making the procedure more comfortable. So we have a water spray. The water spray is a water mist that is sprayed on the surface of the skin, so increasing also the absorption of this water on the surface, and this creates and evaporates along the spray. So this is no consumable, just water, and no harmful effect on the environment, okay? This is very nice. So she purges, because you need to purge the pump, and I don't know what happened, but this pass. Again, we use quite a intense hertz, like 8 hertz, 6 hertz, 4 millimeter spot, and we paint, as we did before, always following the rule of the cosmetic unit. So the purpose of this second spot is to address the vascular component, okay? Is to address the, let's say, the structural component of the dermis, and to address the inflammatory component, okay? See, the patient is very comfortable.
Also, a very excellent technology that is within the Dynamics Max is the ability of having a cooling system integrated within the handpiece. So at the same time that I'm performing the procedure, the handpiece is emitting air and water at the same time. So a cool misting technology, which allows the heat to actually penetrate deeper within the skin, but preserving and making sure that you're not causing any, let's say, potential damage to the epidermis.
So this is a very, very advanced epidermal and dermal protection, mostly epidermal protection, due to a kind of water mist, micronized water mist. You see, the patient is very comfortable. Again, painting, crisscross painting. The laser beam is 4 millimeters, and Dr. Marini is systematically distributing this 4 millimeter spots all over the face, all over the, in this case, the cheek, okay? So again, you will see that the redness is a little bit increasing now. So we are modifying the target that we need to address with this kind of technology. And you will see that's the glow effect, and we're going to have, during the meeting, we're going to have a specific presentation about the Fotona 4 Glow. You will see after a single treatment in 1 month in young patients, you have a glow effect, and without any downtime. So this is a marvelous way of preserving beauty and preserving the young as an expert. Remember that a healthy skin is a beautiful skin, okay? So we are making a healthy skin healthier and this healthy skin longer, okay? This is the purpose of this so-called rejuvenation effect.
Hide your lips just for me. That's
What is the post-op? Post-op is very simple. You know, you have some redness, which lasts for one day, and then the following day you are almost done. Okay, and then we're going to discuss why we use the post-op, Strat Pharma products. We have two products that we're going to discuss today. One is this Colsigen Refresh. Strat Pharma is a company that was always involved in advanced primary dressing after laser procedure. I've been working with Strat Pharma for many, many years, and with a great success for my patient and myself, using the Stratacel and Stratamed. In this case, we have Stratacel. What is Stratacel? Stratacel is a film-forming, silicone-based, semi-permeable formula, sterile. So when we finish any kind of laser procedure, we micro-disrupt the epidermis, okay? And the epidermis is an interface between us and the environment. When the barrier of the epidermis is working, everybody is comfortable. When you start to feel dry, it's already something which is not very comfortable. When you also disrupt the structure, you feel some burning sensation. That means that the epidermis needs some repair. And why don't we use, at the end of the procedure, what happens at the end of the procedure? We have a transepidermal water loss, which is much more intense because the epidermis has been microdamaged. We have edema, we have a kind of erythema and inflammation. So why don't we put a mask that contain a micronized, fully compatible collagen type 3, micronized, derived not from human, not from animals, not from bovine. We know that in the past we even used to inject this collagen into the skin. But what was happening? Because of the origin, which was bovine, we got a lot of reaction. But now, thanks to the recombinant and this kind of technology, you can tell the yeast to produce a compatible type 3 collagen, which is contained in the mask. You may ask, what are you doing with collagen? The collagen is the molecule is too big, it doesn't penetrate. Yes, it penetrates because the micro damage we did is creating some micro channel where the collagen type 3 is entering the superficial dermis. And we have a golden time, which is immediately after the procedure, and also the following day, okay? When this will give immediately a soothing effect. Why? Because we interrupt the transepidermal water loss. We give water back to the patient.
So we finished the second pass.
Yes.
Okay, which was the frac 3, and now we're going to be moving on to the let's say the piano mode, which is a very long 1064 pulse, which within 5 seconds long, which is a very long pulse, which allows us to cause a bulk heating within the deeper tissues in the skin. And this heating, in particular, when we reach a specific temperature, which is around 42 to 43 degrees, stimulates the neocollagenesis, so the production of new collagen over time, okay? So what do patients normally perceive during this treatment? They perceive a little bit of heat, okay, that progressively gets more intense. And fantastic technology here with the handpiece. We're going to show it for you here now. We're able to actually see on our handpiece the temperature that we are achieving. And you can actually set what temperature corresponds to the color on your handpiece. So when it's below 40, for example, it's going to show me that it's in the green area, and when it reaches 40 to 43, it goes to an orange area, and when it's above 43, it's going to go to the red area. When I'm doing this kind of treatment, I always look at the color that is the handpiece is showing me, so I know when I'm reaching that temperature that I want to work in, which is around the 42 to 43 degrees. And I might try to maintain that temperature just for a couple of seconds, and then I move on to the next area that I'm trying to treat, okay? Normally, I perform this kind of treatment over the ligaments of the face, okay? So within the zygomatic malar area and within the jawline and the preauricular area. So I kind of create like a C shape on the patient's, let's say, cheek. Okay, so we're going to start now.
So this is also called vector lift. It's a vector lift using this temperature, always using 1064 wavelength, which is going deeper. Okay, what kind of spot she's using? 9 millimeters. 9 millimeters, okay, with this, it is pretty safe also for the fat. You are not reaching the deep fat, because if you use larger spots, you can melt the fat. You can create apoptotic effect on the fatty layer. The energy that Susanna chose is not that heavy, but you see, look at the flashing light. When the light is flashing, Susanna reached the temperature that you want to obtain, and along the vectors you want to stimulate the collagen with, okay? So this is much more a kind of microsurgical and without the scalpel lifting, so a lifting effect with the erbium, with the Nd:YAG. So going back to the Colsigen mask. So we have many masks on the market. Everybody has a mask. And so why choosing Colsigen? So reliability. The company that's built this mask has a long history of research in primary dressing. And they developed this mask after a deep research about what to obtain to create immediate soothing effect after any laser procedure. So soothing effect makes the patient more comfortable. What is the contact time for the mask? 20 minutes. At the end of the procedure, the patient is not very comfortable. So this is a pampering effect on the patient. The patient needs to come back for another procedure. If the patient is not pleased about this procedure, he said, no, I don't want to come back because it's too painful, it's too irritating, I don't want to have. So the best strategy is to repair or to help the epidermis to recover as fast as possible. So we have an immediate effect, which is the mask applied immediately after the procedure, and we have a prolonged effect during the 2 or 3 other days after. Because the epidermis, as you know, it is not repairing in 24 hours. So we have a baby epidermis that's been disrupted, so it takes some time. When you are more aggressive, it takes almost 2 months to get the epidermis back in shape again. So in this case, we are using this kind of non-aggressive laser procedure. So the golden time for the penetration of this micronized type 3 collagen, humanized collagen, because it's 100% compatible with our own collagen. So we don't have any kind of, allergic reaction. So it penetrates, and according to the hydration, we control the transit number 1. Yes?
Hello. So we finished the third pass, okay, and we're moving on to the last fractional Q switch laser pass, okay. So this is the handpiece that we'll be using, okay. So it's the 9x9 with an LIOB spacer, okay. The this this last pass is particularly helpful to work with the texture, okay, of the skin and to deliver that final glow. We've decided to go for the you can use the standard spacer, but in this particular case, it's her first approach to lasers. She doesn't necessarily. She has a very nice skin already. She doesn't maybe necessarily need a normal spacer, but in particular, she's at a conference. She doesn't want to be maybe slightly more erythema over the the next 6 to 12 hours, because this particular treatment doesn't give you any particular long-term downtime at all, but she wants to be glowing for tonight as well. So that's why we've decided to go for a more conservative approach with the LIOB spacer, which still delivers the energy necessary to create that glow and that texture, uniforming the texture.
So this is the final pass. Susanna just mentioned that's it. We're using LIOB. What is LIOB? Laser-induced optical breakdown. Possible only with a 1064 wavelength with the cones. Okay. So now she's focusing the tip of the cone under the surface. Why? Because we still create some micro disruption of the epidermis without creating any hole, because all the effects happens under the skin. So, and the patient is not suffering, because when we have a larger section of the Nd:YAG laser energy on the surface, we don't stimulate the nerve endings. So we bypass the nerve ending and the patient is comfortable. So this is a very, very nice approach for a patient who is needle phobic, who doesn't want to suffer. So we use this. We can still, as Dr. Marini said, we can restructure the epidermis with this, so which is one of the two major components of the glow. One component is the dermis. When the collagen fibers are arranged very in an orderly way, they reflect the light better. And when the epidermis is working uniformly, also it reflects the light better. So we have the glowing effect, which is a healthy effect of the skin. So going back to the mask. The mask, we like to use it very, very nicely. And the patient likes it. We notice that the healing time is faster, the erythema is shorter, and of course the patient is very pleased about that. The micronized 100% compatible yeast-derived type 3 collagen penetrates and prime the skin. Why? When the fibroblasts that have been triggered to work by the laser we discussed before, they work in an atmosphere of extracellular matrix. When the extracellular matrix is being nourished by new, let's say, supply of collagen type 3, fibroblasts are very happy. So they start to work much better. And this is the secret of this innovative primary dressing after this kind of procedure. Okay, is there any space for the mask the following days after the procedure? Yes, because again, I told you that the barrier doesn't repair immediately. It takes 2 or 3 or 4 days. As a matter of fact, all our patients, they have a proper personalized skincare to prepare the skin before the surgery and to maintain after the surgery. But we interrupt the skincare until the epidermal barrier is completely healed. So if we interrupt, we want to resume the skin care as soon as possible. But in order to do this, we have to take advantage of the golden time of the 1, 2, 3, 4 days after the procedure. In this case, we combine the Colsigen mask with also extra, moist. We can use this moist during the day. The mask we perform at night, and during the day we spray the moist. And is there any place for the Stratacel? Yes. When the skin barrier is not performing well, even after a mask, the first mask we put after the procedure, we remove the mask, and without any epidermal barrier functioning, we have the transepidermal water loss goes out, and so the skin dries again in 45 minutes. Okay, to stop that, we put the Stratacel. Stratacel is a semi-permeable, barrier mimicking, silicone-based, sterile substance. You form a film, and this film prevents a rapid transepidermal water loss after the procedure. Remember, we have inflammation, we have a disruption of the epidermal barrier, not that impressive, but thanks to the synergy between the mask that was removed and the water that started to evaporate, we put some micro drops of, you don't need, this is not a cream, huh? You need to distribute a very thin film of this specific silicone-based formula, which has been using extensively even on aggressive laser procedure, and the healing time is fantastically shortened. And the following days, we do the same. Nighttime, this, following by the Stratacel. Okay? When the Stratacel film is formed, it's like for you to have an intact barrier, semi-permeable. You can also use a moisturizing cream on top, because this is a kind of invisible, barrier mimicking effect. Okay, you say, look, she's doing now the fractional. You see redness. You can see some pinpoint purpuric pixels, because we can disrupt the vessels, the capillaries in the dermis due to the vibrational effect. But we don't create any bleeding, because the focusing is under the skin. So she's using just a single, let's say, a burst of energy per pass, but you can also stack pulses. For example, what happens if you focus this fractional being on the surface and you stack pulses? You go deeper. You dig a deeper hole, because you dig. But what happens if you work under the skin? Do you go any deeper? No, you expand. Okay, the photoacoustic effect to create a much more vibration effect. Okay, the next 3 or 4 days, we said Colsigen Mask and Night, followed by Stratacel and moisturizing cream. And during the day, magic, instead of using springtime or water, we use this Colsigen mist, which contain the same substances. So you spray it, and then you use these Stratacel on top in order to trap this hyperactive formulation on the skin in the golden time, which is 2, 3, 4 days after the surgery, after the procedure. After, when the patient is looking normal, we resume the skincare. Okay? Very fast, she's almost finished. See the redness, but you don't see any kind of bleeding. All the action is under the skin, thanks to the fact that she's using a spacer which is shorter than the regular spacer. So shorter the spacer, the deeper you go with the cone, the tip of the cone. Okay? So this is the concept of LIOB.
We've just finished the treatment, okay? Diana, how are you?
I'm good.
She's good. Excellent. So can you sit up so we can actually have a look at your skin here now? So as Dr. Marini was mentioning, as immediate post-procedure, the skin is showing obviously a mild, let's say, micro damage to the epidermis, a little bit of pinprick bleeding subcutaneously, and obviously there is a little bit of erythema and mild edema, I would say. How do you feel at the moment? What's the kind of sensation that you have on your skin?
Very mild.
Mild tingling.
Mild tingling.
A little bit of burning or hot? Do you feel hot, for example?
A little bit warm.
A little bit of warmth. So warmth is very typical when we have some initial of transepidermal water loss, for example. You can come back down. And this is ideally now, obviously, she is losing some her
Water.
her water, exactly. So what we want to do now is make sure that we're actually closing in that water and to soothe down the feeling of, let's say, tingling, a little bit of hotness that she's got. So we're going to be using the Colsigen mask. So
Colsigen Refresh Mask, is not only suitable for a fast recovery, but you see, the faster the recovery, the less chances for you to develop post-inflammatory hyperpigmentation. Post-inflammatory, in this case, we have a phototype, 2, maximum 3, but in a darker skin, this is a must because you need to immediately stop the inflammation and you keep the inflammation under control and you prevent the post-inflammatory hyperpigmentation. Very important, very important. See?
So this is the mask, okay? I'm gonna gently just place it on her face. Okay, that's it.
See, the mask is very, very large.
Yeah, it fits very nicely.
But you can distribute, it fits all the different kind of anatomy. And the most important thing is to distribute very well the contact of the mask in order for you to feed the area with water. And at the same time, to help the type 3 micronized, humanized collagen through the micro-damaged epidermis in order to create the nice environment for the fibroblasts to work.
Okay. Perfect. I think it's well. The adherence of the mask is very important, so I gently just squish it down onto the skin to make sure that there is the whole surface area of the mask that is able to be in contact with the skin that we've treated is actually there and in contact, okay? So as you can see, it's covering all the area, okay? And how are you feeling at the moment, Diana?
Good.
Good. Good. So she's going to have this soothing effect, which will, for the next 20 minutes, the mask is going to stay in contact with the skin. And she will feel progressively a little bit of the heating will slowly reduce. And yeah, that's it, really.
So you see the glowing effect of the mask. The mask is full of water. And this water also evaporates on the surface, so this creates some cooling effect onto the patients. Okay, so subtracting the temperature, you can see immediately after. Fantastic way of pampering the patient after this kind of. This is after microdermabrasion, which is very common, non that aggressive procedure. So again, particularly in darker skinned individual, this is fundamental. Because again, when you allow the inflammatory reaction to last longer, you create some, let's say, messages to the melanocytes to produce pigments. Okay? What is the post-op? We advise sun protection, and we prescribe sun protection with a filter. Not only for UV, but also for blue light and the violet light, which also have different kind of receptor on the melanocytes that trigger the pigmentation. So the usual standard UV, high SPF UV protection, let's say creams, they protect against the inflammation that the UV creates so it's a macro damage. But you don't protect the epidermis and the melanocyte from triggering the pigmentation from blue light. Oh, congratulations, Susanna. You did very well.
Thank you very much.
Excellent. So, any question from the audience?
About the procedure or anything that
yes.
you wanted to ask? Obviously, we're here and available.
Yes, please.
Hello.
Yes.
It's okay for me. I have just a Dynamics regular one, SP Dynamics. So how does it make sense if I put the thermal spray before the fractory, just like to create the effect of water mist, to increase the absorption of that laser on the surface of the epidermis? Is it a good idea or no need for that?
It depends on, okay, the water mist is evaporating as soon as it's landed on the skin, okay? We use a much higher concentration of water mist to protect, for example, the fatty layer when we use Nd:YAG long pulse with a larger spot, okay? So we kind of cheat the wavelength, which is encountering some absorption on the surface of the skin. So we have a tightening effect, which is much more pronounced on the superficial layer, and we protect the thermal surge on the deeper layer where the fatty layer is. Yes?
Can I combine the peptides with the collagen and with the... How I can combine peptides, because normally I use the CO2 to bring in the deeper skin, the peptides, and then when I cover it with the silicone, I don't know, it works good or not.
Yeah, peptide is good, but it depends on the size. Okay, you know that you have in intact skin can allow 600 kilodalton size to penetrate to an intact skin. Okay, we have a golden time when you did a fragmentation of the epidermis, so the peptides penetrate in spite of the larger size. So if you use the peptides, it's a good strategy, but you don't have the soothing effect of the mask.
So if you wanted to combine the two,
Yes.
maybe as a suggestion, you could put the Colsigen mask beforehand.
Yes.
Okay, because it's hydrating, it's soothing, and it calms down, let's say, that immediate inflammatory process that we've obviously triggered. And after those 20 minutes with the mask, you can remove it, massage the hydration that the mask has left on the skin, and then apply the peptides and the Stratacel on top. So that would probably be my suggestion.
Yes.
on the steps. Okay.
Absolutely correct. So when you put something on the skin, you have penetration, but you also have evaporation. You don't want to lose precious stuff outside. So you use Stratacel to seal it, okay, on the surface. And Stratacel is semi-permeable, so it doesn't create an occlusive effect. So we did a split face study using Stratacel on one side, and the other side we're using Vaseline, okay? Yes, but Vaseline is occlusive. And we got a much prolonged erythema on the area, on the split face, on the face, hemifacial area that was treated with Vaseline. And the patient was feeling much warmer. Are you surprised? No, because we trap all the transepidermal water inside. But on the Stratacel, nothing.
I think you also mentioned earlier about integrating the Colsigen mask in the post-treatment,
Yes.
in a couple days after the treatment. So once again, you could also do your standard procedure within the clinic, but then suggest the Colsigen mask in the next couple of days to help with the healing and speed up the healing process, for example.
Yes.
Yes.
And then I combine it with the LED
Yes.
infrared light, because normally
Yes.
Yes.
the
Yes.
laser, I put it under the LED
I think that's excellent.
to have a lot faster healing. So I can combine the Stratacel and or you put before the LED for
With the LED light?
yeah, for the mitochondrial energy, I think.
We use
Be a good healing.
sure.
Absolutely.
LED is fantastic. It's a photobiomodulation. We use a sandwich technique. We do LED before and then LED after. Okay, and so we trigger the cells, activity in order for the cell to respond very well to our laser procedure. And then after the Colsigen mask, after we put the Stratacel, then the skin is transparent. Then LED. LED is penetrating in spite of what we put on. Okay, and what kind of LED we use? Red and infrared. 6:30, 8:40. Yes. Any other question, ladies and gentlemen?
Yes, thank you very much for an excellent presentation and lecture. I have two questions. Do you also advise patients to use Stratacel at home after the procedure?
Yes, yes. Yes, because again, I told you that we have a golden time for penetration, but we have a not very golden much time because the healing process is still going on. So we need to provide the proper, let's say, barrier mimicking effect with something that is very well accepted by the patient. And this is why we use Stratacel after.
I actually feel a lot of patients prefer Stratacel to other quite ointment-based
Oh, yeah, sure.
creams, well, ointments, because they're very rich, whereas Stratacel, you don't need that much product. And that's something very important. You need to educate your patients on how to use Stratacel. You need a few drops, 5 drops, I would probably say, on the face, 2 on the cheeks, 1 on the forehead, 1 on the chin and 1 on the nose, and you educate the patient to apply it, and that's enough. And I would probably suggest to patients to apply it initially maybe 3 times a day, and then twice a day.
Exactly.
Maybe it depends what kind of treatment you're also delivering. With the one that we've done today, Fotona 4 Glow, I would probably suggest them to do this for 2 to 3 days maximum, and it also, I also tell my patients they need to listen to their skin as well. So I can give them an advice on how long the average person will be able to recover, but obviously everyone is very different and their skin will react very differently. So if their erythema or slight redness might persist for longer, I would suggest them to continue with the Stratacel for that much longer. And the end point, I would probably advise patients when that erythema and that redness has improved. That's when I would suggest them to move on to their maintenance skincare.
Yes.
Thank you. And my second question, do you see a role of collagen masks in everyday, let's say, skincare? So not only after procedures, but also for rejuvenation, just using it like skincare?
Well, I think that's the mask is a very important medical device because it contains not only water and it doesn't not only give you a soothing effect, but contains some important ingredients, which is the micronized, humanized, 100% compatible collagen type 3. So if the skin barrier is intact, so you're losing the possibility for this collagen to penetrate. So it could be a waste to using this kind of mask for a long time. So I think that this mask, the role is to accompany the patient as soon as possible after the procedure and until the epidermis is healed.
And that can take up to 2 weeks.
Yes, yes. It
again,
depends on the procedure.
On the structural, let's say, epidermal damage that we've created. If we were doing a treatment that was a bit more aggressive, for example, then the downtime could be longer. It could be even a month of downtime. Maybe the first 7 days or so, where the skin can be quite red, quite erythematous, and burning sensation. That's when Stratacel is your number 1 ally. Later on, however, when the skin has healed, I would say that Colsigen will give you that extra soothing effect that can accompany the skin with a quicker recovery, but especially makes the patient more comfortable also at home with the hydrating properties that the mask can give.
Yes, yeah. Remember that the research that Strat Pharma did, this company is dealing with primary dressing. So primary dressing is a must of any kind of laser procedure. So if you are good and understand the importance of the primary dressing, then you don't have any surprises because you know what to do after the laser procedure. As I said before, it's not that when we finish the procedure, we finish with the patient. We finish with the patient when the patient is healed. So patients are different. Patients, the procedure are different. The more aggressive the procedure, the prolonged downtime. And the prolonged downtime, more Colsigen mask, because we have the soothing effect and the collagen penetration. Then when we finish, as a maintenance, you can do a cool mist, always followed by Stratacel. Remember the Stratacel, and I suggest the company Stratpharma, if they don't have it already, to set some videos in order for the patients to see what to apply and how to apply, because they think it's a cream. It's not a cream, okay? It's a film forming. So you form a film which is mimicking the epidermal barrier.
And because it's mimicking the epidermal barrier, I think that's something else that I tell my patients is after they've had the initial, obviously, inflammatory process that has subsided and they're still using Stratacel, they can actually wear makeup on top of it. So they can use pigmented creams or, pigment to cover that,
Redness.
let's say, redness that sometimes can be longer lasting if especially they've done a bit more of an aggressive treatment. So that's something very important, that maybe ointment-based creams or ointments are not, don't give you that opportunity.
So
So
Stratacel
that's also very important to remember.
is a barrier mimicking, effect. So it's a temporary substitute of a micro-damaged epidermal barrier. On top, when the film is stabilized on the skin, you can apply a moisturizing cream on top, like you do on a regular skin. Okay? You can apply some, let's say, makeup on top, because you already have a protective kind of film. So this is the advantage of this wonderful technology. Okay?
Thank you very much.
Thank you very much.
Thanks.
Thank you, Susanna.
Thank you.